Tell me honestly, is getting implants painful or not?
It causes intense, severe panic attacks in both the attending doctors and the affected patients.
How long can it really last for me in real life without all those marketing stories?
Well, to say that it can last for a lifetime, probably that's not entirely true. Eventually, you could lose all the implants that were placed.
What advice would you give to those who are watching right now who are afraid and worried? I want to talk to you in simple terms about what to do if a person has no teeth at all. How often do you encounter such cases in your practice?
Actually, in our clinic, this is the most common type of patient, someone who has no teeth at all. But I would rephrase it a little bit. Such patients come in with teeth, but unfortunately, almost all of the teeth they have need to be extracted. As a result, the patient is left completely without teeth. So what should be done in this case? The most common and, let's say, the most budget-friendly option is, of course, removable dentures. Of course, we offer removable prosthetics. This is a standard removable denture.
I've heard that lower dentures don't stay in place very well at all. If people actually acquire them and then subsequently complain, why do they even bother to obtain them in the very first place?
In reality, this is a very sensitive topic. What you're talking about now causes wild frustration for both doctors and patients when it comes to removable dentures, especially for the lower jaw. Here, everything is both as simple as possible and at the same time complicated. Everyone has their own circumstances. That is, if the conditions in the mouth allow it, specifically the physiological conditions, most often we're talking about the alveolar ridge, the part on which the denture rests. If this alveolar ridge is well formed, then in principle, a lower removable denture holds very well on the lower jaw.
What does this ridge depend on? So this is basically the area where the teeth used to be, right?
Absolutely right.
And the denture sort of holds on to it?
Exactly. So yes, this ridge, you're correct, is where the teeth used to be. Some people, even though they've been without teeth for a very long time, still have a well-formed ridge that's not even atrophied. But sometimes, on the contrary, a person has lost their teeth only recently, and the ridge slowly starts to atrophy. The bone simply recedes, because without load, of course, the bone diminishes. So there are no teeth anymore, there's no load, and the bone, let's say, isn't functioning, the bone isn't working, and it starts to recede. Of course, there are various creams, different adhesives, some pads and liners. Patients who actually wear removable dentures and have problems with this ridge all know that the fixation only lasts for a few hours, and even then, sometimes adhesives don't help much. And also because the lower jaw, or more precisely the mucosa of the lower jaw, is very mobile. And when we place a removable denture, the mucosa moves and the denture pops out instantly.
Because of the tongue, right?
Absolutely right, yes. It's precisely because of the tongue that the mucosa is mobile, and the denture practically doesn't stay in place. And
is it possible to place such dentures both on the upper and lower jaws if needed?
Of course, both on the upper and lower jaws. And do you see what the paradox is? This removable denture on the upper jaw is already quite bulky, it's really huge. That is, it covers the entire upper palate. So it's kind of hanging up there, and according to the laws of gravity, it should fall down. Actually, no, because a special valve zone is created there and it works like a suction cup. Just like a real suction cup, it sticks and holds in place. But by the way, there are also nuances when the palate is shaped differently, and in such cases, the upper denture might not stay in place. But most often, there are no problems with the fixation of the upper denture. The upper denture has a different issue, getting used to it, because it's a very large foreign object in the mouth. And on the contrary, on the lower jaw, it's a small, rather elegant horseshoe-shaped denture that you would think is much smaller and easier to get used to, but its fixation is worse.
So the peculiarity is that it's easier to get used to the lower one simply because the denture itself is smaller, but it moves around all the time. And on the upper jaw, on the contrary, it attaches well, but it's too big. So if your palate is covered by this denture, you don't feel the warmth of the food, but what about the taste? Do you feel whether it's tasty, salty, or sweet?
Got it. I wouldn't say that right away. Actually, you can get used to both the upper and lower dentures. You can absolutely get used to it. Even patients whose denture doesn't stay in place eventually get used to it. So really, it all depends on the patient themselves and their goal. You have to get used to it anyway. So whether it's an upper or lower denture, the main thing is the desire to adapt. There are certain rules for how to do this, to get used to it. Wear the denture for longer periods. At the very beginning, when the denture is fitted for the patient, whether it's upper, lower, or both, the main task is to wear it for the first month, really wear it without taking it off in order to get used to it.
Surely there are people who come to you with several teeth left. There must be some whose teeth are still in good condition and can be kept. So what do you do in such cases?
Here too, it's important to understand how many teeth are left. Sometimes there are
2 or 3, for example.
If there are 2 or 3 teeth, then again, the decision is made together with the patient. We explained that we can make a removable denture that, let's say, will go around these 2 existing teeth. There will be an opening in that denture for those teeth. So the denture will look like this with your own remaining teeth. As an option, we can make special clasps or hooks. These are used to attach the denture to those teeth, whether it's on the upper or lower jaw. This approach can work as well. Or together with the patient, we explain that it's possible to make a structure, let's say, on implants. These teeth are removed, implants are placed, and the patient can comfortably wear a fixed denture on the implants. But once again, I want to emphasize that everything is discussed and decided together with the patient. If the patient is willing to keep the teeth, especially when we're talking about the lower jaw, then on the lower jaw we try very hard to preserve every tooth, because having support on the lower jaw is extremely important. So if the patient is willing to keep the tooth, it's not a problem. We make a removable denture, we create special clasps, and simply work around, let's say, this particular tooth. As a result, we get a denture with a small opening right where our tooth is, either for 1 or 2 teeth. But this applies if we're talking about 2 or 3 teeth. Sometimes there are more teeth involved, and when there are more teeth, we can already fabricate other options. For example, a clasp retained or precision attachment partial denture, which will be securely fixed, or a clasp-based partial denture. So everything is very individual and needs to be assessed on a case-by-case basis. There is another way to restore teeth using removable dentures, especially when the teeth have poor retention. For example, if we are talking about the lower jaw, it is possible to place 2 implants. So only 2 implants are placed, and then the patient is sent home for about 4 to 6 months while the implants integrate. After that, we install so-called button attachments, specifically ball-shaped button attachments, and the patient will secure their lower removable denture directly onto these 2 attachments. And not placing them in the central area right here, this is for retention. This is done so that the lower denture holds better. This is the second option for removable prosthetics. You put it on easily, go about your day without worrying that it will pop out or fall off, and then, just like before, you remove it at night, clean it, and put it away.
So it's kind of like on snap fasteners, which I can take off and put on myself. That's
simple.
Basically, it's like 2 teeth that will be reinforced.
You described the snap fastener exactly right. It's just like the button on clothing. You know, a snap button, with the receiver and the button itself. We fasten them ourselves on a jacket or a down coat, and that's exactly the same principle here.
How practical is this option, really? Is it something worth considering for yourself?
Well, actually, it's quite practical. Of course, in many cases, saving money and financial feasibility play a big role here. For example, a patient wants to save money and says, let's say we would offer them the all-on-4 or all-on-6 technology. But that's much more expensive. So most often it's really dictated by the cost. But as an alternative, it's absolutely fine. The most important thing here is to remove and put it on correctly, because very often patients, especially when taking it off, remove it unevenly and create a lever effect, which gradually starts to loosen these supporting implants. That's probably the main problem with it. Otherwise, for the lower jaw, especially again for patients who don't want to do all-on-4, all-on-6, or a large number of implants, it's a great solution.
So in this case, I would get, say, 2 implants. And for example, if I later decide I want to get all-on-4 or all-on-6, what then? So then I would have to unscrew those implants? And would I need to put in new ones, or could I just add more, like in this case? How does it work in this situation?
Right now, in our clinic, we've actually been doing this for a very long time. Implantology, and accordingly, we always try to keep this perspective in mind when we work. That is, we place these 2 implants with the idea that the patient can later add 2 more implants to create a 4-implant structure. This is absolutely possible. It's perfectly normal.
I know that the all-on-4 procedure can be done in 1 or 2 visits, sometimes in just a few days. And if I have 2 implants placed and then add more, will I have teeth during that time? I mean, will they be put in right away? Or will I have to wear a removable denture for a while, like before?
If a patient already has 2 implants and wants to add 2 more to create a full structure. With 4 implants, you'll get your teeth on the 3rd day as well, so it's done pretty quickly.
So if I already have 2 implants and I add 2 more, the prosthesis, the new teeth, they'll be placed right away on all 4 implants, correct?
Absolutely right. Absolutely right. And on the 3rd day too.
So this construction with 2 implants, is it really only reasonable to use it for the lower jaw, and for the upper jaw just use a regular denture? Or does it also make sense to put 2 implants in the upper jaw?
There might be a reason to do it, but honestly, we have very few cases like that. Most often it's done on the lower jaw, most often on the lower. You can do it on the upper jaw, but here you see with the technique, let's call all these techniques all on 2, even though it's not exactly a technique, but let's call it that for now. So with the all on 2 technique on the upper jaw, the prosthesis, in terms of its size, will still be the same as a removable denture. So its dimensions will be exactly the same. So honestly, I don't really see the point in it. I mean, if a removable denture holds well on the upper jaw, what's the purpose of those 2 implants there? You put it on and wear it comfortably because we still can't significantly reduce the size and that bulkiness will still be there. I have
Exchange?
Yeah, so that's why I think it's not reasonable to place 2 implants in the upper jaw. If you want something better, then it's better to go straight for 4 and make a more elegant prosthesis. The third option for complete tooth loss or full edentulism is the technology called all-on-4 or the all-on-6 technology. So we place 4 or 6 implants for the patient on one jaw. That's what we're talking about now, right? And within literally 3 days, an adaptive prosthesis is made for them. And basically, after just 3 days, the patient leaves us already with new teeth.
So you usually place 4 implants there, is that correct?
This is also always decided together with the patient. Ideally, of course, it's best to place 6 implants simply because there are more supports. Actually, I would really like to talk about the differences between this technology in Sinon 4 and Sinon 6. Many people don't understand and mix it all up or lump everything together. So when we talk about the all-on-4 technology, we need to clearly understand that the number of teeth with this method on one jaw after placing 4 implants can range from 8 to a maximum of 12. 8 to 12 teeth, that's the total we can do, depending on the arrangement, the shape of the jaw, and various other nuances. And it also depends on the patient's individual physiological characteristics. So that's why it's from 8 to 12. That's with the all-on-4 technology. But with the advanced all-on-6 technology, we can achieve a full, complete row of 12 to 14 beautiful teeth. A full row on one single jaw typically consists of 14 teeth. So in total, we should end up with 28 teeth.
The choice between all-on-4 and all-on-6 is really about how many teeth you'll end up having.
Absolutely right. And of course, the price. The price, of course, is different, definitely.
Which technology is used more often, on 4 or 6 implants? Stereo?
Actually, I think lately all-on-4 has been used the most. In my opinion, this is mostly due to the price. So people are really voting with their wallets and just want to have at least some teeth. That's why all-on-4 is more common than all-on-6. A smile has a huge impact on quality of life. People who get their smile back start finding jobs, inviting neighbors and friends over for dinner. They start interacting more with the world, but often, before this desire for a full life, there's the fear of pain. The best way to get rid of it is to talk to someone. Even a completely free and comprehensive consultation can very often help with this, where you can openly and thoroughly discuss your current dental situation and any related concerns with a highly competent and experienced professional. So if you've been hesitating to get implants for a long time but are ready to take action, write to us on WhatsApp using the link in the description. I'll support you personally in your specific case.
If such a prosthesis can't be removed, then some food must accumulate there, right? In any case, food gets stuck under the prosthesis, and essentially you end up with food trapped between the prosthesis and your gum. Doesn't it ever start to smell bad there? Or is there something else? How do people even live with this? And
what about behind the prosthesis? But with this technology, whether it's all-on-4 or all-on-6, it doesn't matter. If you don't take care of the prosthesis, meaning you don't clean it properly, because specifically in our clinic, the very first thing we do on the very first day, meaning as soon as the patient gets their temporary prosthesis, as soon as we place it for them, we immediately give them a gift. An irrigator. This is a device that, with a stream of water under pressure, cleans out and flushes away debris, kind of like a kercher, like at a car wash. It blasts out everything from under that gap between the gum. And with this device, it removes all food particles from there. That's the first thing. Second, we give the patient a whole video guide specially developed for this purpose. How do you properly brush your teeth? It covers brushes, special interdental brushes, different types of brushes, and even how to use floss. That's why overall the hygiene aspect is the most important part of this technology. So care must be extremely thorough. Food will definitely get stuck there, definitely. After every meal, you need to rinse your mouth and clean everything out with an irrigator. Or at the very least, use an irrigator and a brush twice a day. This is absolutely essential. Otherwise, as you said, that plaque will just sit there, ferment, let's call it that. And of course, it will smell and worst of all, it will gradually infect over time our implants. Because essentially, the food will rot and eventually you could lose all the implants you've had placed.
So you still have to diligently take care of these precious teeth too, right? Because I genuinely thought once you acquired them, you could simply walk around like a powerful Robocop with indestructible teeth, not have to do anything at all, and just happily and effortlessly chew away at everything.
I'll tell you even more. It doesn't matter if it's just one implant that we've placed and put a crown on, or if we've used the all-on-4 technique and restored all the teeth, or if we've used the all-on-4 technique and restored all the teeth. Caring for an implant should be even more thorough than for your own natural teeth. This is something you need to clearly understand and remember. Everyone who is planning to get implants in the future, you need to understand this clearly. That means you absolutely must maintain good hygiene, very, very thoroughly. So it's not like being a Robocop. Let's take the all-on-4 technique as an example. We've made the prosthesis and installed it. And when the patient doesn't clean them on these artificial teeth, which you might think are just artificial, made of plastic, but what could possibly happen to them? It's as if nothing should happen to them. They're made of polymer, but the same kind of tartar forms on them. They also get stained just the same. For example, if the patient smokes, drinks tea or coffee. So there's absolutely no difference at all. That's why care needs to be very thorough. This needs to be clearly understood. Hygiene, hygiene, and more hygiene. And at least twice a year, you should visit your prosthodontist so that the doctor can remove it right there in the chair. The doctor removes it. And twice a year, we always do a cleaning of this prosthesis. The prosthesis is removed and cleaned. Either the doctor does it themselves using a special ultrasonic cleaner. We place it in there and the ultrasound dislodges on a micro level all the plaque and microorganisms from the structure of the prosthesis, and then it's put back. Or sometimes we even have to send such a prosthesis to the lab, where under laboratory conditions it is cleaned with special brushes and pastes, polished, and then we put back on an almost new prosthesis. So cleaning is absolutely necessary. Not just at home, but also in the doctor's chair once every 6 months.
In general, what are the consequences if, for example, I don't clean it well? What is the worst thing that could happen?
Plaque that accumulates around this connector. Our implant is placed very deep. To connect the implant to our construction, to the same prosthesis, a special connector is used. It's called a multi-unit or a multi-unit abutment, or simply an abutment as it's also called. This connector between our implant, which is deep in the bone, and our construction, right around it. Plaque starts to build up around it, and this plaque gradually begins to seep in, seeping deeper and deeper, and eventually we can infect the implant. And the same thing will happen as with our teeth. It will start to rot. And after a certain amount of time, you'll simply lose the implant. It will fall out because it gets infected, so we need to make sure nothing accumulates around it. This is the abutment, which will rise above our gum, because part of it will be inside the implant and part of it will protrude above the gum. So we have to take care of this abutment ourselves to make sure nothing builds up on it. Otherwise, plaque will just keep spreading. That's it.
People probably often get upset when you tell them they need to brush their teeth.
No, they don't get upset, of course. Maybe we just, let's say, cut them off a little, but care, again, care, and again, care is even more important than for your own teeth. Nature hasn't come up with anything better yet.
Also, it's often said in dental clinics that you'll need to have a permanent restoration installed. I just don't understand what this permanent restoration is and why it can't be placed right away. Why do I have to come back again, pay more money, and so on? What is this permanent restoration for, anyway?
Let's take the all-on-4 technique as an example. For instance, let's look at the all-on-4 technique. The patient has had 4 implants placed, Impressions are taken on the same day the implants are placed and the patient as well. Then we calmly let the patient go for 2 to 3 days so that their new teeth can be made. After 3 days, the new teeth are ready, the patient comes back and we install them. And we call this an adaptive or temporary prosthesis. We more often call this an adaptive prosthesis, which the patient should wear for 6 months or sometimes even a year. In other words, they can comfortably wear it for up to a year. Why is this necessary? It's so that we can adapt the maxillofacial apparatus to the new teeth, because the patients who come to us are almost always those who not only have no teeth, but have even forgotten what a proper bite is. Their jaw is protruded, their face has changed shape, even down to wrinkles, so we need to adapt things correctly. That means the prosthodontist and the technician have a lot of work to do. They establish the necessary bite at the optimal position that we need, or whatever is physiologically comfortable for our patient, because even the joint has already adapted to the new one. Our temporomandibular joint has gotten used to the new bite. That's why we do this, so that the adaptation process allows the patient to get used to the new bite. It's impossible, believe me, it's impossible to make a prosthesis right away. Just imagine a permanent one at the moment when there was no bite at all. We consider all the pros and cons. That is, during the use of this prosthesis, the doctor can even see exactly where, let's say, the load is distributed, where there is some wear, because the teeth we make are made of plastic. They get worn down in some places, chipped in others, and for the prosthodontist and the dental technician, this is invaluable information. In the future, in a year or 6 months, when we make the permanent teeth, all of this can be taken into account. That's why this is absolutely necessary. In fact, by the way, it's even specified in the SIM4 technology protocol. Without an adaptive temporary prosthesis, no permanent teeth are allowed. So first, an adaptive prosthesis is used for 6 months or a year, and only then should the doctor make the permanent prosthesis. And here, of course, the weight of the structure also plays a role, if we consider the weight of the construction. The all-on-4, which is made immediately after the surgery. Of course, it's a very lightweight structure, even though it's reinforced with a metal bar inside, it's still light. And if we're talking about the same type of prosthesis, so we're always talking about the prosthesis, whether it's zirconia or metal ceramic, that's obviously a much heavier structure. And if we hang such a structure on implants that we've just placed, we'll simply pull out all the implants and that's it. So, as I said, there are plenty of reasons for this. But the main reason is specifically the adaptation of our maxillofacial system to the required bite. And let's say we adapt, adjust, and check everything. Possible mistakes or any potential problems that may arise with the permanent prosthesis. And
now tell me honestly, is getting implants painful or not?
I always speak honestly. As for whether it's painful or not, it's actually an uncomfortable procedure. Because if we're talking about when we place the implants themselves, we do it under local anesthesia, so it's almost the same as dental treatment. Just like when we treat teeth, you come in, get numbed, and we treat you. The only difference is that the anesthesia used is surgical, let's say, and it's deeper. But we only block pain sensitivity, so you don't feel any pain. But if you remember how your tooth was treated under anesthesia, you'll recall that it didn't hurt at all, but you could feel the vibration, you could hear the noise, the suction, the drill, the doctors talking, and I don't know, the music playing in the dental office. So for example, when the doctor is doing something inside, you feel some pressure. You might feel them working or fiddling around inside, but it doesn't hurt. It's exactly the same here. In other words, you won't feel any pain sensitivity. But you will feel some tactile sensations like pressure, fullness. I'm talking about implantation now. Pressure, fullness, vibrations, and of course those not so pleasant sounds. You'll hear them too. And that's exactly why this procedure is uncomfortable and unpleasant. You need to be mentally prepared for that. That's why, for example, in our clinic, and I think in many other clinics as well, we try to play calm music. We even ask the patient what kind of music they like. This is simply so the patient can relax. We try to stay in contact with them, talk to them, distract them, of course. How are you doing? So that the patient at least makes eye contact with us, or at least hums or makes some sound just to distract them. Because honestly, the procedure is not a pleasant one. It's a medical procedure, and like any medical procedure, it's uncomfortable. But it definitely isn't painful.
But sometimes after dental treatment, it's like, well, when they're doing everything, it doesn't hurt, everything's fine. But then when the anesthesia starts to wear off, some pain begins. And the doctor also Well, in my experience, often says that there might be some pain for a day or two, but with implantation, it's definitely a more extensive procedure. So after the anesthesia wears off, if some pain appears or something like that, are there any things that would it be important for someone who's considering getting implants to know about these things?
First of all, of course, after implant placement, specifically in our clinic, even before placing the implants, we give the patient painkillers right in the form of a tablet. And after the implantation, we also give them a painkiller injection right into the muscle, into the gluteus. And most importantly, the patient receives a full set of medications right at the clinic. And among them, there are painkillers, which the patient will take for 3 to 7 days. And basically, there's no need to endure pain. No one should force themselves to tolerate pain. As soon as you feel any discomfort, moreover, all the medications are modern and well studied. We know that, for example, 2 tablets of Nice will ensure you are completely pain-free. That will be enough for you for the whole day. You take it in the morning, take it in the evening, and if during the day you start to feel pain again and you start to notice it, take it again. And all of this will last literally up to 3 days. Because the peak, especially after implantation, the peak of post-implant sensations is on the 3rd day. After that, everything starts to subside, the oral cavity or the oral mucosa, or basically everything related to the mouth, heals and recovers very quickly. So let's say you just need to endure this discomfort, but there really shouldn't be any severe or intense pain. By the way, if there is pain, we have a clear protocol for our patients. If it's a kind of pain that you can't tolerate, call the dental clinic immediately. We'll invite you in right away and the doctor will examine you. In other words, there shouldn't be any pain after the surgery. There might be some discomfort, but definitely no pain. That's why painkillers really help a lot and will make your life much easier in this regard. We take a blood sample from your finger. So, we've taken blood from your finger. And for another 1 or 2 days, the spot where the blood was taken still hurts. For example, it bothers you when you press on it. Now imagine, we've performed a surgery. We made an incision, drilled, first cut the gum, then drilled into the bone. Of course, it's still going to be uncomfortable and cause some discomfort. But thanks to modern painkillers, and I'll say it again, we can simply avoid that. You won't feel the pain as much. Just take them and you'll feel much better. This is
The healing process, how long does it take? After about 5 to 7 days, is everything healed or how does it work?
I don't think, usually after a week, it's definitely healed. For some people, it might be a bit sooner, but after a week, you definitely won't have that kind of pain anymore.
And how long does such a construction actually last? If you go through the trouble, get an implant and have a prosthesis put in, how long can it realistically last in my life? Without any marketing talk, without all those stories, how long will it really last for me in real life?
Of course, there are a lot of nuances again, but if we turn to, let's say, some scientific studies, which, by the way, there are plenty of online, anyone can find them. Now, a patient can read this, so to speak. The average lifespan is from 8 to 12 years. But if the patient actually takes care of them, at our clinic, for example, we offer a lifetime guarantee if the patient comes to us every 6 months. We really can provide a lifetime guarantee for these implants. If something goes wrong, we'll simply, so to speak, redo it. In other words, we'll put in another implant, you see? But to say that it can truly last a lifetime, well, that's probably not entirely accurate. This is a living body bone, and unfortunately, bone loss happens to everyone as they age. So basically, all the same processes occur as with your own teeth. Atrophy happens, bone resorption occurs, and the same thing happens with implants. That is, the implant starts to become exposed. And here you just need to monitor it, and if you take proper care of it, we really can extend its lifespan for a very, very long time. And there are people whose implants last for a very long time. So in reality, the long-term results are quite significant. But judging by, let's say, the literature we rely on, or the experience we observe, yes, such a structure, more precisely the implants themselves, not the prosthetic structure, last from 8 to 12 years. But again, that's not all implants. It could be 1 or 2, so we're not saying that all your implants will be affected. No, of course not. We're talking about a single implant, apparently, that one started to fail somewhere. The gum recedes, the bone goes away, but we simply decide to replace the implant and put in a new one, and the patient continues on as usual.
How much would each of these options actually cost a person in real life? How much would they
need to spend on this? Well, let me try to give you some numbers, not just rough estimates, but as precise as possible, let me tell you. So if we're talking about the all-on-4 technology, then if you don't need so-called bone grafting or bone augmentation, then this procedure can be done for 255,000 rubles.
Is that for one jaw?
That's for one jaw, yes. If bone grafting is needed, then it's 330. And we're talking about this with an adaptive prosthesis.
And if it's for two, do we just multiply by 2?
Yes, that's absolutely correct. And if in 6 months or a year we need a permanent prosthesis as well, right? That's an additional 250 to 350,000 per jaw. So in reality, we can estimate that one jaw will cost us 500 to 600,000 rubles. That is a finished construction, let's say, already with a permanent structure, from 500 to 600 per jaw. So for both jaws, it's about 1,200,000.
But that means you don't have to pay all that money at once, right?
No, of course not. It's all done in stages, naturally. So first the initial construction is done, you go home, and only after 6 months or a year do you get the permanent structure.
Okay, and if you put a removable structure on 2 implants, how much would that cost?
Well, somewhere between 150 and 180,000.
And what about a removable denture?
A removable denture costs from 35 to 50,000.
So are they the same for the upper and lower jaw?
Yes, the removable denture is exactly the same. I'd also like to add that when it comes to the cost, it actually varies from clinic to clinic. And right now it can really vary a lot. From the lowest price, let's say from 120,000 rubles up to 500,000 rubles for the first stage with the adaptation and temporary structure. And this is where it's really hard for patients to choose. The patient doesn't always understand. That's why the main point here, first of all, as I said before, is to always clarify regarding first whether I will have an adaptation denture and to understand that cost. Then be sure to ask how much more it will cost for the permanent structure. And then you understand the total cost. And as for these variations, somewhere it's cheaper, somewhere it's more expensive. But here I think it's entirely up to the patient. Because the technology, more or less, is already quite well developed, not just here in Russia, but generally worldwide. And there are also a lot of clinics that provide this service. All the surgeons are already, let's say, well trained in this area. There are a lot of professionals now. And here I believe, as I said, you probably need to vote with your heart, so to speak. That is, if you trust, if you've talked to the surgeon and you feel confident, then stay. And these financial questions, of course, are important, but I would still vote with my heart, so to speak. If you like the doctor, that's it, go ahead. And as for how much it costs, I think, of course, it's important, but here I wouldn't say that expensive is always bad, nor would I say you should go looking for something cheaper. That is, it can be done well even at a low cost. Just really try to filter out for yourself. And if you can say, I trust this person, that's what matters. So visit 3 to 5 clinics and decide for yourself which doctor or which clinic suits you best. And then calmly go ahead and stay with your choice.
What advice would you give to those who are watching now, who are afraid and worried?
Well, to make up your mind. I believe that every patient who comes to our clinic or to any other clinic is someone who has made a decision. And honestly, that patient is, let's say, brave. Because, of course, it's a medical procedure and naturally there are certain internal fears. So first and foremost, you just need to make the decision. At least start with a consultation. In other words, at least start moving toward your goal. If your goal is to restore your smile, to restore your teeth, in other words, to get your former smile back, then of course you just need to start with a consultation. That is, make an appointment for a consultation. Nowadays, there are many clinics that offer free consultations. Come in, take a look, listen, so that the doctor, by all means, does not rely on the internet or anything else for that matter. Only an in-person doctor, only real communication, only live contact or meeting with the doctor will help you make any decisions. So book a consultation, just start with a consultation and then take it from there. You will also understand what to do next and whether you want to proceed further. But you need to start with a consultation so the doctor can take a look what your situation is. Maybe this technology isn't suitable for you at all, and there are alternatives. You might end up with only a removable denture while you're thinking things over or getting ready. So it's better to go, see, understand, and then make a decision for yourself later on. Subscribe to the channel, leave your comments, let us know if you learned something new, and take care of yourselves.